Hi everyone! Welcome to part 2 of the Volunteer Training for Disability Service. This training program is designed to educate new volunteers and family caregivers on effective strategies to best accommodate people with disabilities. In the last part, we introduced what disabilities are and how they affect communities as a whole. In this segment, we will be discussing disability etiquette training. As a CrowdMe volunteer, you are taking your first step in doing important inclusion work and assistance, while also taking a stand against ableism, as you will learn important tips to assist your recruitment. Before we begin, let's set some terminology. You always want to put the person first. Say person with a disability rather than disabled person, or people with disabilities rather than the disabled. If you are not sure what words to use, ask. Avoid outdated terms like handicapped, crippled, or retarded. Failing to describe a person in this way promotes dehumanization, even if it is not intentional. Now that that's set, let's get into some more details. The most important thing about disability inclusion work is always ask before you help. You also want to be sensitive about physical contact. Some people with disabilities depend on their arm for balance. Grabbing them, even if your intention is to assist, could knock them off their balance. Avoid patting a person on the head or touching his wheelchair, scooter, or cane. People with disabilities consider their equipment part of their personal space. Don't make assumptions. People with disabilities are the best judge of what they can or cannot do. Always ask and don't make decisions for them about participating in an activity that they think they can do. Respond graciously. When people who have disabilities ask for an accommodation at your business, it is not a complaint. It shows that they feel comfortable enough with you. And if they get a positive response, they will probably come back again and tell their friends about the good service they received, a higher rating for you. For wheelchairs. People who use wheelchairs are individuals, not equipment. Don't push or touch a person's wheelchair. It is part of her personal space, and if you help someone down a curb without waiting for instructions, you may dump her out of the chair. You may detach the chair's parts if you lift it by the handles or footrest. Keep the ramps and wheelchair-accessible doors to your building unlocked and unblocked. Be aware of a person's reach limits. Place as many items as possible within their grasp. Make sure that there is a clear path of travel to shelves and display racks. When talking to a person using a wheelchair, grab your own chair and sit at her level. If that's not possible, stand at a slight distance so that she isn't straining her neck to make eye contact with you. If the service counter at your place of business is too high for a person using a wheelchair to reach, step around it to provide service, or have a clipboard handy if filling forms and providing signatures is expected. People who use canes or crutches need their arms to balance themselves, so never grab them. Pushing the door open from behind or unexpectedly opening the door may cause them to fall. People who do not have a visible disability may have needs related to their mobility. For example, a person with a respiratory or heart condition may have trouble walking long distances or walking quickly. Be sure that your museum, hotel, or department store has ample benches for people to sit and rest on. For blind and low vision, identify yourself before you make physical contact with a person who is blind. Tell him your name and your role if it's appropriate, such as security guard, usher, caseworker, receptionist, or fellow student, and be sure to introduce him to others who are in the group so that he is not excluded. If a new customer or employee is blind or has low vision, offer him a tour of your facility. People who are blind may need their arms for balance, so offer your arm. Don't take his if he needs to be guided. If the person has a guide dog, walk on the side opposite the dog. And don't touch the person's cane or guide dog because the dog is working and needs to concentrate. The cane is a part of the person's personal space. Offer to read written information such as a menu, merchandise labels, or bank statements to customers who are blind. Count out change so that they know which bills are which. If you serve food to a person who is blind, let him know where it is on the plate according to a clock orientation, where, for example, 12 o'clock is furthest from them and 6 o'clock is nearest. For low vision, good lighting is very important, but it shouldn't be too bright. In fact, very shiny paper or walls can produce a glare that disturbs people's eyes. For deaf and hearing loss. To work with a person who is deaf, it is important to know American Sign Language, or ASL. People who have hearing loss, however, communicate in English. Follow the person's cues to find out if she prefers sign language, gesturing, writing, or speaking. And when using a sign language interpreter, look directly at the person who is deaf and not the interpreter, and maintain eye contact to be polite. People who are deaf need to be included in the decision-making process for issues that affect them. Don't decide for them. Before speaking to a person who is deaf or has a loss of hearing, make sure that you get her attention. Depending on the situation, you can extend your arm and wave your hand, tap on her shoulder, or flicker the lights. Rephrase rather than repeat sentences that the person does not understand. And speak clearly. For speech disabilities, give the person your full attention. If you are not sure whether you have understood, you can repeat for verification. And do not tease or laugh at a person with a speech disability. For persons with short stature, be aware of having necessary items within the person's reach to the maximum extent possible. As with people who have other disabilities, never pet or kiss a person of short stature on the head. Communication can be easier when people are at the same level. Persons of short stature have different preferences. For people with cerebral palsy and Tourettetes, many people with cerebral palsy have slurred speech and involuntary body movements. Your impulse may be to discount what they have to say based on their appearance, but monitor your responses and interact with the person as you would anyone else. People with Tourette syndrome may have vocalizations or gestures such as tics that they cannot control. For people with epilepsy or seizure disorders, if a person has a seizure, you cannot do anything to stop it. If he has fallen, make sure that his head is protected and wait for the seizure to end. And when the seizure has ended, the person may feel disoriented and embarrassed. Try to ensure that he has the privacy to collect himself. People with psychiatric disabilities or mental illness. People with psychiatric disabilities may at times have difficulty coping with the tasks and interactions of daily life. Their disorder may interfere with their ability to feel, think, or relate to others. Stress can affect the person's ability to function. Try to keep the pressure of the situation to a minimum. People who have psychiatric disabilities have varying personalities and different ways of coping with their disability. Some may have trouble picking up on social cues, and others may be super sensitive. One person may have very high energy, while someone else may appear sluggish. But treat each person as an individual. Ask what will make him most comfortable and respect his needs to the maximum extent possible. In a crisis, stay calm and be supportive as you would with anyone else. Autism spectrum disorder is a developmental disability that affects each person differently and with varying levels of severity. Typically, autism impacts a person's ability in the areas of social skills, communication, self-regulation, repetitive behaviors. Speak to the person as you would any other adult. Don't assume that he or she has an intellectual disability, because most of the time people with this disorder have either average or above average intelligence. Some people with autism may be nonverbal and may not use spoken language. She may prefer to use pictograms or to write to convey information to you. Be clear and literal and concise in your speech. It may be necessary to repeat a statement or rephrase it. If the environment has noisy or has distractions, ask the person if she would prefer to move to another setting. Wait for a response if you ask a question or give a direction. It may take time for the person to process the information and respond. Do not assume that the person is not paying attention to you if she does not look at you while you are talking. Keep in mind that changes in a routine or schedule may be upsetting or confusing to the person with autism. Explain the change ahead of time, if possible. For example, the cafeteria may be closed for a couple of days. Remind her if necessary. Remember, people with autism can and do live independent lives. Living and working in the community, they want to be treated with respect and have their dignity recognized. For people with intellectual disabilities, speak to the person as you would any other adult. Use simple language and do not use baby talk. Use clear, concise, short sentences with simple language. Do not give more than one direction in a sentence. Be prepared to repeat yourself or use other words if he does not respond. Be patient and allow time for the person with an intellectual disability to process the information before responding. People with intellectual abilities may be anxious to please or to agree with what you say. Be sure he knows he can refuse to do something or say he doesn't know what you mean. This is especially important in certain situations, such as a law enforcement or healthcare. Keep in mind that noisy environments or ones with many distractions may make it difficult for her to focus on a task or direction, especially when first learning how to do something. Do not assume that a person with an intellectual disability cannot learn. He may only need a little more time and attention to transfer what is learned in one situation to another. Clear signage and pictograms identifying different areas of facility may increase his ability to navigate through a building. Remember, people with intellectual disabilities can and do work independently and productively in the community. They want to be treated with respect and accorded their human dignity. Learning disabilities are lifelong disorders that interfere with a person's ability to receive, express, or process information. People with dyslexia or other reading disabilities have trouble reading written information. Give them verbal explanations and allow extra time for reading. Don't be surprised if you tell a person very simple instructions and he requests that you write them down, because spoken information gets scrambled as he listens. A person who has a learning disability, such as auditory processing disorder, may need information demonstrated or in writing. Ask the person how you can best relay information. Be direct in your communication. People with traumatic or acquired brain injury. Some of the factors that affect people with learning disabilities also apply to people with traumatic brain injury. People with brain injury may have a loss of muscle control or mobility that is not obvious. A person with a brain injury may have poor impulse control. The person may make inappropriate comments and may not understand social cues or get indications that he or she has offended someone. In her frustration to understand or to get her own ideas across, she may seem pushy. All of these behaviors arise as a result of the injury. A person with a brain injury may be unable to follow directions due to poor short-term memory or poor directional orientation. She may ask to be accompanied, or she may use a guide dog for orientation, although she does not appear to be mobility impaired. If you are not sure that the person understands you, ask if she would like you to write down what you were saying. The person may have trouble concentrating or organizing her thoughts, especially in an overstimulating environment, like a crowded movie theater or transportation terminal. Be patient. You might suggest going somewhere with fewer distractions. Conflict management. Sometimes conflicts arise between people with disabilities and the places that they visit for work, recreation, healthcare, or education. These conflicts are usually the result of misunderstanding or a lack of information. Sometimes, conflicts develop between people with disabilities who have conflicting needs. For example, a person who has a hearing loss cannot hear the proceedings with the window open, but a person with multiple chemical sensitivity needs the window open for fresh air. Someone who uses a service dog may run into a conflict with a person who has an anxiety disorder and an extreme fear of dogs. All of these situations call for flexibility, patience, creativity, and open communication. A willingness to listen to the other person's perspective and to learn. Sometimes, good faith efforts are not enough, and parties have difficulty working out their differences. In these cases, consider using the services of a skilled mediator. For a final word, people with disabilities are individuals with families, jobs, hobbies, likes and dislikes, and problems and joys. While disability is an integral part of who they are, it alone does not define them. Don't make them into disability heroes or victims. Treat them as individuals. Thank you so much for watching. In the next segment, we will discuss qualities regarding disabilities. And have a wonderful rest of your day. Thank you.